Hi there, Dr. Steve Z with you here again for the 5th time. Thanks for joining. I'm one of the emergency physicians at Enloe Medical Center, and I want to update you about your experience when you come to the emergency department. As you're probably aware, the state has entered into a 4-tier system as of September. Now the tiers are a function of 2 different metrics. One is the positivity rate in that community. In other words, the percentage of people who take a test that test positive. And the second is the adjusted case rate. So out of 100,000 people, how many people are testing positive? So that's something that the state and the counties work on. And what we're doing is aligning our visitor policy here in the emergency department with the tier system. Tier 1 is the highest or the worst tier to be in a pandemic. That's where we were in September, and we're doing a little bit better here now in October. So when you come to the emergency department, it'll tell you that there could be some restrictions. The restrictions in tiers 2 and 3 and 4 are that you're still allowed to have 1 visitor in the emergency department and 2 visitors on a case-by-case and exception basis. But we do ask you to be mindful about that 1 visitor. Ask yourself the question, because this is a pandemic, do I really need somebody here with me in an indoor environment where there are people who might be sick? And if you do, then to please consider those people. Are they a little older? Do they have any risk factors? Maybe that's not the best person and you should think of somebody else. And also, of course, if anybody's not feeling well, if they're feeling sick or ill, they shouldn't be coming into the emergency department. But please feel welcome to bring a visitor with you when we're at tier 2. Now, if you take a look at the other tiers, tier 1, things will be a little bit different. That's when the pandemic, the metrics are at their worst. That color's purple. If we're in tier 1, and there's a good chance this fall and winter we very well could be, then there will be restrictions, and we want you to know about them. There'll be basically a no visitor policy in the emergency department with the exceptions of parents who need to be there for kids, essential caregivers, essential translators and historians, and some case-by-case evaluation. But remember, we're doing all this to keep you safe, to keep us safe, to keep our families safe so that we can continue to take care of this community. So we're all in it together. We all need to work together to make this happen. Then I want to talk to you about masking. That's really our best defense and our best medicine right now against this virus. So you'll see that I'm wearing a blue surgical mask. If you meet me in the emergency department, I'm also at that time going to be wearing an N95 mask. We don't ask you to have that, but we ask you to have a good mask. So first there's proper wearage, and we have a sign about this that you'll also be able to get when you're inside. It's got to cover the nose and it's got to cover the mouth, and it has to do it at all times. When you're in the room and you're there with a visitor and nobody is in the room as a healthcare provider, please don't take off your mask, because at that time you're putting things out into the environment and everybody's getting at a greater risk of getting the virus if anybody should have it. And of course, that's the problem with this virus. We don't always know that we have it or that we're contagious. So, proper mask wearage at all time. That means not under the nose. That means not saying, Dr. Steve, let me tell you about what's going on with me, and pulling it down. I can hear you through the mask. It'll be okay. And then lastly, what kind of a mask do you have? Unfortunately, they're not all created equal. We have these masks available for you here at the hospital. So if you're coming in with a bandana, or you're coming in with a valve mask, which is great for the fires, but not great for a pandemic. If you're coming in with a mask that's kind of got the nose, it's always like this because it just doesn't fit right. If you've got a single fabric mask, any of these type of masks that don't provide the best protection to you and to us and to our community, we're going to ask you to put it in your pocket, keep it for other occasions if you need, and we'll provide you with one of these. That's how we're going to be able to deal with this going forward. It's great to see you again. Stay safe, stay healthy, be well.